Here we're going to go over anatomy of the flexor musculature of the forearm and common flexor tendon of the elbow. Here we're looking essentially at the lateral elbow. You can appreciate the annular ligament and the radial collateral ligament. And now we're rotating anteriorly. You can appreciate the joint capsule. You can see how the annular ligament essentially wraps around the radial head. You can appreciate some of the flexor musculature in the forearm. You can see the pronator teres. You can see the flexor carpi radialis, palmaris longus. You can see the flexor carpi ulnaris, which has two heads. Here you can also appreciate the osborn fascia, which essentially goes from the olecranon to the medial epicondyle. And now we're removing the flexor carpi ulnaris muscle, and you can appreciate the various bands of the ulnar collateral ligament, including the posterior, transverse, and anterior bundles of the ulnar collateral ligament. And here again, you can see the common flexor tendon. Now we're making the superficial musculature translucent. You can see the underlying flexor digitorum superficialis muscle, which is the next layer of musculature in the volar forearm. And now we're removing that muscle, and you can see the underlying flexor digitorum profundus and flexor pollicis longus muscles. And here you can see the remaining fascial coverings of the superficial musculature of the volar forearm, as well as the fascial covering of the flexor digitorum superficialis muscle. Now we're removing the flexor digitorum profundus and flexor pollicis longus muscles, and now you can see the underlying interosseous membrane. Here we're actually looking at the supinator muscle. You can see it wrapping around the proximal radius, and it originates from the proximal radial aspect of the ulnar, and again wraps around the proximal radius mostly on its radial aspect. And now we're rotating laterally. Again, you can appreciate the annular ligament, the radial collateral ligament, and the lateral ulnar collateral ligament. Here we're looking at the olecranon, and again we're looking at the ulnar collateral ligament with the various bundles. You can appreciate the underlying joint capsule, and here we're rotating anteriorly again, and now we're making the capsule translucent. You can see the underlying hyaline cartilage of the trochlea and the capitellum. You can also appreciate the anterior fat pad as well. And again, we have a good view here of the annular ligament and the radial collateral ligament and the lateral ulnar collateral ligament. You can appreciate the posterior aspect of the capsule with the posterior fat pad as well. Here we're going to go through some axial sections of the forearm musculature, focusing on the flexor musculature. Looks like we're starting off in probably the midshaft of the ulna and the radius. You can see the interosseous membrane. You can appreciate the flexor carpi ulnaris muscle, as well as the palmaris longus and flexor carpi radialis muscles, as well as the flexor digitorum profundus muscle and the flexor pollicis longus muscle. And it looks like we're seeing a bit of the flexor digitorum superficialis muscle as well. And here we're going proximally. Here you can see a good view of the supinator muscle that essentially wraps around the radius and originates from the proximal radial ulna. And here we're going further cephalad. You can start seeing the radial neck. You can appreciate the annular ligament. And here you're starting to see the pronator teres muscle, which inserts on the radial shaft just below the supinator muscle. And here we're going further proximally. You can see the articulation of the ulna within the olecranon fossa. Here you can see the origin of the pronator teres muscle just above the medial epicondyle. You can also see the separate tendons, essentially, of the common flexor tendon, consisting of the flexor carpi radialis, palmaris longus, flexor digitorum superficialis, and flexor carpi ulnaris tendons. And here is the olecranon fossa, as well as the anterior and posterior fat pads. Now we're going to go ahead and do some sagittal cross-section anatomy review through the medial elbow. Here you can see the flexor carpi ulnaris muscle, the palmaris longus, flexor carpi radialis muscle, pronator teres muscle. You can appreciate the anterior fat pad. You can appreciate the trochlea and the capitellum. And you can get a glimpse of the annular ligament. For technical reasons, the flexor carpi radialis and palmaris longus muscles are white in this depiction. And now we're going in a lateral direction. We're starting to cut through the flexor carpi ulnaris muscle and the flexor carpi radialis and palmaris longus muscles. You can see a glimpse of the anterior and posterior bundles of the ulnar collateral ligament. And now we're going further radially. We can see the articulation of the trochlea with the ulna. You can also see the transverse bundle of the ulnar collateral ligament. Here again, you can see the attachment of the anterior bundle of the ulnar collateral ligament on the sublime tubercle of the ulna. You can also see the ulnar origin of the pronator teres muscle, as well as the flexor digitorum profundus muscle as well. And here's a good view of the anterior and posterior fat pads, where the anterior fat pad sits in front of the coronoid fossa, and the posterior fat pad is within the olecranon fossa. Here we're going a bit more radial. Here we can start seeing the flexor digitorum superficialis muscle. We can also see the oblique cord, and here's a nice view of the coronoid process of the ulna. And we can also get a glimpse of the interosseous membrane. We can also start seeing the supinator muscle wrapping around the proximal radius. And we can see the insertion of the pronator teres muscle on the radius, as well as the origin, essentially, of the flexor pollicis along this muscle. And here we're going further radial. You can appreciate the radial head, and here you can appreciate the radial collateral ligament and the lateral ulnar collateral ligament, as well as the annular ligament.